Good morning. Hello, my name is David Shapiro, and I'm the program manager for Healthlinks. Our team would like to thank you for joining us for our fourth town hall meeting, Managing Depression and Enhancing Wellness Through COVID-19. This is the second town hall we've hosted on promoting mental health as we all deal with the coronavirus. The pandemic has impacted us all, and we want you to know that through our work and through these town hall series, we're committed to providing you with tips and resources to support yourself and your teams. We want you to know and feel that we are all in this together. Healthlinks is a mentoring program that champions health and safety at work. Our mission is to advance worker health, safety, and well-being. We offer evidence-based healthy workplace certification and advising to help organizations and their teams achieve total worker health. As a nonprofit program of the Center for Health, Work, and Environment at the Colorado School of Public Health, our experience as researchers informs everything we do. Our center is one of 6 centers of excellence for total worker health, funded by the National Institute for Occupational Safety and Health, NIOSH, at the Centers for Disease Control and Prevention, the CDC. A few general housekeeping notes before we get started with today's presentation. Everyone is on mute throughout the duration of this presentation. If you're experiencing any technical difficulties, you can use the chat function to let us know what you're experiencing, or we can help troubleshoot in any way. And we will have time for question and answer at the conclusion of the presentation. Please use the Q&A box at the control panel for asking your any questions you may have. The webinar is being recorded today, and upon wrap up in the next day or so, we'll be sending the webinar recording as well as the slides from our presenter. And last, I'll mention this at the end of our webinar today as well. There is a survey that we'd like you to complete at the end of the webinar. It really just takes a minute or two to complete, but your survey responses do help inform our future topics. So we appreciate you taking a moment to do that as we wrap up today. Agenda for today, quick overview. We're going to have a presentation followed by a question and answer session. So with that, I'd like to introduce our presenter today, Dr. Alex Reid. Dr. Reid is the Director of Behavioral Health Education at the University of Colorado Family Medicine Residency and is an assistant professor in the Department of Family Medicine at the University of Colorado School of Medicine. Dr. Reid is also team psychologist for the Denver Nuggets. Thank you, Alex, for joining us today and for talking to us about managing depression and enhancing wellness through COVID-19.
Okay, thanks so much, David, and glad to be here talking with you all, and I'm hoping you'll walk away with some tools as this is an incredibly stressful and overwhelming time, to say the least. So right now I will share my screen, and let's go to it. Okay. So yeah, so we're going to talk about quite a few things this morning, and then have an opportunity to for you, the audience, to ask questions and for me to try to answer those as best I can. So the objectives for today's talk are first, to learn to identify signs of depression or mood concerns during these stressful times. Second, I'm going to go over evidence-based tools, and these have an incredible amount of data to back them up for how these can be used to boost your mood, reduce stress, and so forth. And some of these you may already be familiar with, some may be new. And we'll also talk about some resources and strategies to manage the isolation, which is a big part of our current pandemic, and how do you connect with others as well. Okay, so really like this picture. This is from when Hurricane Katrina was first making landfall, and I think it just speaks to the power and the emotion that I know I'm certainly feeling, and many of others may be feeling, of just this, there is a storm that has been coming for some time, and we truly don't know what all of the havoc will be there's an incredible amount of uncertainty. Say a little bit, what's different from this current pandemic versus Hurricane Katrina is there could be things that are seen. So that's a bit of a difference, but that foreboding, that uncertainty, stress, and so forth. So very powerful image. So, this outbreak puts us at risk, all of us at risk for various type of mood symptoms and anxiety symptoms. Uh, the way our brains and bodies are built, we are being tested in many different ways. And with that, we're at risk, all of us, for having all different types of symptoms. So this can be understandably and naturally fear about your own health, as well as the health of your loved ones, those that may be living with you or perhaps are in different parts of the country or world. Having just feeling down, feeling sad, and that can be caused by a number of different factors, including isolation, the constant news that we're receiving, changing information, and so forth. So it's a tough time. There may be changes in eating patterns where one can find that they're eating more than usual, or they may just have no appetite as well. We'll talk a little bit about some nutritional ideas. I saw an article recently in the New York Times about we're all turning to junk food as well in time, to provide some comfort as well. That can also have some negative effects in the long term. Difficulty sleeping. Many of us are having problems sleeping, and that is absolutely normal at this time, where one may be waking up in the middle of the night or having trouble falling asleep, or even waking up early as well. And those difficulty sleeping can certainly compound mood difficulties. Troubles concentrating as well. A lot of information coming our way, a lot of uncertainties I've mentioned. Can feel irritable as well. At times you may be feeling fine, but may notice that that your fuse is a bit shorter than it has been in the past. And people can also experience fatigue, just feeling more tired. That may be due in part to sleep difficulties or not, or feeling restless and perhaps on edge, where it's difficult to sit still, and that can get in the way. One symptom that I don't have on here, and this is one that's a bit more, all of these can be serious symptoms that can lead to symptoms of depression. Suicide and suicidal thoughts are also something that can come, especially from experiencing many of these different symptoms. So, and also pessimism and just hopelessness. Those can be strong hallmarks of feeling down and sad. All right, now I'd like to open it up to a poll. And so you're going to be asked to fill this out, and please know that all your answers are anonymous, so you can't be identified through participating in this poll. But this may give a sense of what are you all experiencing with your mood. So please just click one of those.
We've got a lot of responses coming in, so I'll just give it another minute.
Yeah, thanks everyone for filling that out. That'll really give us a temperature, a sense of the room.
Okay, I'll share the results. Can you see the results, Alex?
I can see them. Yes. Thank you so much. So, looking at this, many of you are noticing feelings of worry, anxiety, and feeling down. A number of you are feeling anxious, but not necessarily down. And some maybe, much smaller percentage are feeling down, but not necessarily anxious. And 80% are neither anxious nor depressed. So So with that, I want to show you, because this poll, I actually copied these questions uh, from a poll that was just recently released from the McKinsey company. And so this looks at, this came out last week and asked participants, are they feeling anxious or depressed in the past week? And looking at this, our results for the most part reflect this, but a higher percentage are feeling, for the most part, anxious and depressed, or anxious but not depressed. And few of us are feeling neither anxious or depressed. And I think that really makes sense with, with all that is going on, all that we are trying to manage at this time. So know that, what we're all experiencing, what we're feeling, is consistent with how many people are feeling across the US. So what to do when you're feeling down during this outbreak? And so I'm going to go over a lot of tools. Some of these are my absolute favorite tools. I work as not only as an educator, but also a clinician at the A.F. Williams Family Medicine Clinic, which is also a residency program here in Denver. And so as a behavioral health provider, these are the tools that I frequently recommend to the people that I serve in our clinic, alongside the family docs that I'm privileged to work with. So, I saw this made me chuckle, with the COVID-19 relief. Some thoughts have been that since we're all probably experiencing panic disorder, that part of this should be a prescription for 1,000 Xanax. So that will help us through this difficult time. Now, not advocating Xanax as a long-term tool, but I think this speaks to what we need, and we need all different kinds of relief at this time. So the first one, and this has so much research behind it, one of my favorites, is doing something pleasurable. So the idea is, and there's a strong body of evidence backing this up. It's the idea of scheduling pleasurable activities. We often schedule in our calendar things that we must do that are important. They may be urgent as well. Those may be doctor's appointments, they may be other things, but they may not be things necessarily that we consider pleasurable. And so this is doing that very task. So the technical term for this in the behavioral health world is behavioral activation. You schedule a pleasurable activity, ideally once a day. Kind of think of this as a daily vitamin for your mood. And we know from quite a bit of research, and that's cited here, one of the earlier studies looking at this, is that this can be as effective as cognitive therapy, which is the type of therapy that is focused on what types of thoughts are you having, as well as some antidepressants. And it typically takes about anywhere from 4 to 6 weeks to notice the effects, though those can be a lot faster. And this is one of the tools that I actually use to track this and give out to patients that I serve. So the idea is putting in, what is your activity that you're going to do? You can just put in, if you're not sure of something that you want to do, you're just having difficulty coming up with something, you can Google a pleasurable activity list. You may be able to get ideas from friends or colleagues as well, or think about something that you used to do that has just been, you haven't done for some time. So with that, you would plan when you're going to do that, and you could do this the night before. What time are you going to do it? And then, did you do it, yes or no? And then, how is your mood before and afterwards? What we know from also quite a bit of research is that when you begin to track behaviors, you then change them. We know from people completing food diaries that the more they track it, the more they manage it. So that's recommendation number one. Number two, and this was something that Alex Reid, who spoke last week, reviewed, and I'm just going to review this again in a slightly different tool. So this is called the 4-7-8 breath, though some of the things are pretty similar. So what you'll do is you'll first just exhale completely through your mouth and making a whooshing sound. You're going to close your mouth and then inhale quietly through your nose to a mental count of 4. So 4 in, and then you'll hold your breath. Now you don't have to hold up for a count of 7. So for some of us that may be too long. So you could, just do this for 4 or 5, whatever is most comfortable. And then what you'll do is you'll exhale through your mouth, ideally pursing your lips like that. And the idea is then breathing out for a count of 8. So I'd like you to all try that. I'm going to do this as well. So that's what it ideally should look like. And then you can do this again for about 3 more times. What's wonderful about this specific technique is that it sets off your relaxation system. This is something that is built into all of our bodies. The technical or fancy term is the parasympathetic nervous system. When we are experiencing stress, anxiety, depression, that sets off our fight or flight system, which is automatic. So we have no control over this, and it's a good thing we do have it. We wouldn't have survived as a species if we didn't have it. However, there are a lot of dangers now which we don't fully comprehend, and so it's a lot harder right now. And this can be one tool to help settle your body. Okay, the next one, this is one you may be familiar with. There's so much research out there on this that it's beginning to get a little boring. That exercise reduces depressive symptoms, and it's just a great tool. And the big thing is, though, that I've seen for many folks that I've worked with over the years is that when they decide to get back into exercise, they may remember back 15 years ago when they could bench press 300 pounds. They're going to go out and do that, and then what happens? They experience significant pain. I've tried this once or twice and have learned my lesson. So the idea of really just starting slowly, easing into it, and not trying to be a hero the first time you go exercise. This can be tremendous for your mood. Really almost acts as stress inoculation as well. So it's kind of like getting a flu shot for stress when you exercise. So you reduce the amount of stress that you can experience. So one, I can't recommend enough. If we had a pill for this, for the benefits from exercise, we would take this pill every day. So the next one, this is a cognitive technique that is one of my absolute faves. So the idea behind this is to disrupt your thoughts. When we are stressed, down, angry, scared, we can experience all different kinds of negative thoughts and irrational thoughts as well. We may catastrophize, we may do should statements. The psychologist in me, I sometimes do the psychologist dad joke, so we can be guilty or victims of shoulding all over ourselves, so can get us into trouble and have emotional consequences. So a great way of disrupting these is asking yourself a question. So questions such as, if my best friend or someone I loved had this thought, what would I tell them? Or if you were to ask or tell yourself that, how would you think that would be helpful? And the idea behind this is really to allow a response that's consistent with your values. Instead of reacting negatively, instead of reacting to your initial negative thoughts. So all of us would give caring, thoughtful, and respectful advice to those that we love or our best friends. And this is a way of tapping into that inner advisor, that inner wisdom that we all have. It can just be harder to tap into when we're feeling worried or down. So one strategy I learned from a patient they did was they actually they wrote down the question that they wanted to ask themselves, and then they actually put it on their phone. They took a picture and they put it on their home screen. And by doing that, in the moment when they were having those thoughts, they could pull it up, look at the screen, and it's private. No one else knows what you're looking at. 3 good things. Next one. So this one, so good. Such a great tool. And this comes originally from the University of Pennsylvania uh, and their positive psychology lab. So with Martin Seligman, who's a famous psychologist, who's done a lot of work in this area. So the idea behind 3 good things is to begin to cultivate gratitude. So each day for at least 1 week, write down 3 things that went well for you today. So the items can be relatively small. So my partner made the coffee today, or I earned a big promotion. You can give the event a title. You know, my daughter made a hilarious joke. My daughter does make really funny jokes, as does my son. So write down exactly what happened in as much detail as possible, including what you did or said, and if others were involved, what they did or said. Include how this event made you feel at the time and how this event made you feel later, including now as you remember it. And this is really important. This is a key part. Explain what you think caused this event, why it came to pass. And don't worry about how you write this. You know, you don't have to be neat. It doesn't have to have perfect grammar, spelling, and use as much detail as you would like. The research behind this is incredibly compelling. So this was a study looking at participants who were experiencing depressive symptoms. You can see that on the y-axis, and on the x-axis, the time after they did this intervention. So they did it for 1 week. The placebo group just did their usual activities. What they found was they had both groups had about equal numbers of depressive symptoms. After they engaged in this 3 good things, immediately afterwards, there were effects with their mood, and these effects lasted for up to 6 months. So something that you can do for 1 week can last up to 6 months. And I'll share one thing that I am grateful for. I am grateful for the howling that's happening 8 p.m. Every night for all of our healthcare providers. So love that ritual. It's a way of belonging, to feeling like I belong, and I'm working together with all my fellow neighbors in Denver and in Colorado. So that's just one thing I've enjoyed. Next thing, social connections. We are social creatures and we need relationships. This is how our brain is wired. So I want to read a quote from a clinical psychologist, John Arden, who worked for many years heading up clinical psychology services at Kaiser Permanente in California. And here's a quote from John. "We have these social brain networks that need to be fostered and kindled and cultivated through a lifetime. And those people who don't do this tend to be more depressed, more anxious, get ill more often, and get dementia symptoms much earlier than others. For example, we know that telomeres, which are the caps and the ends of our chromosomes, actually shrink with loneliness. So social connectivity, as in good quality social relationships, has multiple benefits to our immune system and to our mental health, even down to the chromosomal level. Now, we're challenged by this with social isolation, with all of our, for many of us, our daily routines disrupted. So, people are being very creative in the ways that they're connecting. I'm not a stockholder of Zoom. I'm not being paid to say this, but Zoom or other platforms like this can be ways of connecting with others. My birthday was just a few days ago, and my wife connected me with friends all over the country, and that was such an incredible treat, and it felt so good. So nutrition. Now, I think of our bodies as Ferraris. So they have been well developed over the years. And yet, in this time when we're down, feeling stressed, we can eat more poorly. And, when we're not eating so well, then that can have an effect on the machine that is our body, and really can affect the structure and the functioning of your brain and ultimately your mood. The Western diet, which, there are absolutely delicious things there, though not necessarily the healthiest for us, can have an effect on our mood. So there's a growing body of research, and this area is actually called nutritional psychiatry. And what researchers to date have found is that one particular diet can help elevate elevate mood and reduce depressive symptoms. And that, not surprisingly, is the Mediterranean diet. So, of course, at the base of this is daily physical activity, but you can see some of the different foods there. So fruits, vegetables, whole grains, olive oil, and then less, trying to eat less frequently, meats, sweets. So if you can utilize aspects of the Mediterranean diet, you may notice differences with your mood and how you're coping. Sleep we know is essential for mood regulation, also to help manage stress, and it's a tough time. Many of us are having trouble sleeping, and that is absolutely normal. So this particular tip is, if you're finding that you're just laying in bed and you're tossing and turning and thinking about a lot of stuff, the idea is to, if you can't fall asleep within 15 minutes, get out of bed and go do something relaxing, boring. Try not to do screen time, because screen time will actually wake your brain up. And if you don't have your phone or screen set to a blue light filter, that blue light, which is akin to the rays of the sun, will also wake your brain up and tell you it's time to wake up. When you start to feel sleepy, then go back to bed. And the goal is really to reconnect your bed with being asleep. So you generally don't want to have TVs in the bedroom. You really want it just for sleep only. And the other part is, try to make environmentally, make your bedroom like a cave. So as best you can, though this cave does have a tremendous view, make it dark, make it cool, and make it quiet. All of those factors can help quiet your brain and help you to sleep more effectively. Limiting exposure to the news. There's a lot of information that is coming our way, and it can be very upsetting, uncertain. We're seeing an incredible amount of death and all of these sad, scary stories. And so just being mindful of how much do you watch, and making sure that maybe there are other things you could be doing. Some of the things that I recommended just on this slide deck to offset the news you may be watching. Putting feelings into words. So this is something that the psychologists I've known for some time. There's incredible evidence that highlights what happens when you put your feelings into words. So researchers at the University of California back in 2007 found that when participants in their studies labeled the feelings that they were feeling in situations where they may be provoked to be angry or sad, what it actually did was it lowered the area of excitation or stimulation, specifically the fight or flight response, which the amygdala is a part of. When people labeled their feelings, their brain reduced the stress response. So saying how you feel makes you feel better. And it's funny, when I talk with folks about this, I think about my children. My kids are very good at putting, especially when they were younger, putting their feelings out there very clearly. They would say, Daddy, I'm scared, or Mommy, I'm worried. As adults, we may not say that as much. We may say that I'm stressed, or, they were doing this and that bothered me. But actually labeling the feelings, that can help reduce stress. And, talking with someone in particular that you trust can help you to reduce that stress. But making sure too that you also choose the right time to talk. So, whoever you may be talking to, your friend, your partner, perhaps a trained therapist, or your healthcare provider, making sure that it's also the right time. So writing it out, or journaling, also really striking research that's been conducted by Dr. Penniger for many years. He's down in Texas. And when we hold back our feelings and thoughts, that can have an effect on stress and disease. And writing about upsetting experiences helps to improve the immune system and reduce stress. So writing out your feelings, you can write, you say exactly how you're feeling and because. So this could be one example that we adults could use, or this could also be used with kiddos as well. Writing it out helps to just reduce those levels of sadness, anger, feeling fearful, disgust, or so forth. Bonuses is all of these tools that I've gone over, everything, these work for kids. So, keep that in mind if you want to use not for your children as well. All right, so we're going to ask the audience now. So I've thrown a lot of tools out at you. So which of these tools have you tried?
Still have a lot of responses coming in. Give it one more minute.
Thank you. I'm very curious to see what the audience picks.
All right, looks like it's slowing down. I'll go ahead and share the results.
Great, thank you. All right, well, great to see these results. And I'm delighted that folks are doing so much exercise, that they're wisely limiting the news, talking with trusted friends, deep breathing, making sure you're eating healthy. So excellent. This is as a clinical psychologist, this warms my heart to see all the things that you're doing. So let's go on to the next one now. Based on what you've learned today, which of these tools are you thinking about trying now? Thanks for filling this out, and know that your responses are anonymous.
I'll give it one more minute here.
Thank you.
All right, looks like it's slowing down.
All right. Well, looks like the number one thing that folks are going to try is the 3 good things. That is fantastic. Such a great tool, easy to do. I recently actually did this for a training with uh, both staff and team members with the Denver Nuggets, and this was one that they particularly enjoyed playing around with. So I hope you do too, and it's something that you can also share with your partner as well, or your kids, really anyone. Okay, so one thing I just want to say is if the feelings that you're experiencing are just becoming so overwhelming that you don't know what to do, please contact your healthcare provider. They'll be able to connect you with providers in the community so that way you can get relief for the difficulties that you're experiencing. These are just some resources available to you. The CDC has some excellent ideas on managing stress. The American Psychological Association has a whole host of tools that you can utilize, as well as our University of Colorado Department of Psychiatry. There are tools both for adults and kids. NAMI has tools, that's the National Alliance for Mental Illness. And then the Greater Good Science Center at Berkeley, so that's in part where I got the instructions for the 3 good things, which those I really like those ones in particular. Oops, I didn't mean to do that. Go back. Sorry about that. There we go. So our objectives, we talked about identifying signs of depression or mood concerns during stressful times, and know that this is understandable with all of the stress and strain we're under in this pandemic situation. We've also talked about evidence-based tools to boost your mood. A lot of you are doing great things. Keep those up. And I hope you try some of the other tools that I discussed, especially those 3 good things. That's a lot of fun. And there are resources, and we've gone over strategies to help manage isolation and connect with others. And that can be using Zoom, a lot of different ways of doing this, connecting through FaceTime, and maybe even sharing some of the things that you're grateful for to those that you're connecting with. So at this point, I'd like to open it up to any questions that the audience may have for me.
Great, thank you, Alex. So you can stop sharing your screen at this point if you'd like, and we'll have more of sort of a town hall discussion. We've had a number of really great questions come in. There's one that came up for me and then was repeated by an attendee, which was, we had a recent town hall series on the importance of leaders and leadership at this time. And specifically, we talked about leaders and self-care, and the idea that you need to put your own oxygen mask on first. So let's say that leaders and supervisors are able to accomplish this and take care of themselves. One of the questions we have is, how can we give information and support employees that we manage as supervisors? How can we have a dialogue to promote some of these things and have our employees that we supervise or people that are on our teams also make some of this a reality?
Great question. I think 2 things. The first is being curious, with those that you may be supervising or leading. How are they coping? How are they holding up through all of this? And the curiosity of what are they doing to manage? I think normalizing that it can be hard to focus and concentrate, and so some of the things that I mentioned that can go along with mood symptoms. I think normalizing that, and then maybe even sharing some of the things that you as a supervisor or leader may be doing for yourself. So that way, that can help to once again normalize and say that it's okay to try these things out as well.
Great, thanks, Alex. I'm going to try and group a few questions that came in together, which have to do with the ups and downs that people are feeling right now. And so there's been some questions that came in. I know from my own personal challenges over the past several weeks that there are some mornings we wake up and we feel like we can really tackle these great exercises that you're giving us, and then at some point in the day we really experience, you know, negativity or the opposite happening. Sometimes that's a full day for people. They have a good day and sort of a bad one. And so I'm just curious if you can give us a little bit of insight or thoughts about how to manage the ups and downs that we're all feeling right now. Like I said, either hour to hour or in some cases full days to days.
Yeah, that's a you know, that is one that so many of us are experiencing. So even myself included. And so with that, I think, you know, part of it is, you know, the first is being kind to oneself and being compassionate. We are going to have ups and downs with our moods. That's the way our bodies are built. And with all of the information that we've got, that will have an effect on us. So with that, you know, yeah, sometimes I am going to feel down and overwhelmed, and that's okay. And also saying, you know, I've got the tools that I can use to, you know, to help bring me back up as well. You know, from some of the things I may have talked about to some of the tools you may use for yourself. Um, so with that, you know, those can be great tools, you know, and really focusing on that.
Great, thank you. I mean, along similar lines, um, what advice do you have for people focusing on the present moment rather than stressors in the future? So we all have a lot of responsibility right now when it comes to work, family. I know that there are people participating that are worried about loved ones that are, you know, distant from them, or maybe experiencing a new life event in the future. We have at our center several colleagues that are pregnant or about to start a new family. So how can people manage what they need to take care of in the moment versus sort of the stressors that they're have going on that may be, you know, in the future? Any suggestions there?
Yeah, so part of it is right how to stay present focused, uh, when you need to as well. And so tools to first maybe calm and relax your body and your mind can be using, you know, just taking some of those deep breaths first to just center yourself. And it may also be writing out a list. So you could be creating that structure for yourself. So that way, you know, that way you are, you know what you need to accomplish, and those can be you know, they can be small things that you set for yourself for that day. And when you check those off, those can be small wins that can give you a sense of accomplishment. Know that you've completed them as well.
Great. I really like the, you know, focusing on your breath in the moment as something that we can all do sort of right now. There's been a lot of honesty, in what people are sharing on the Q&A, Alex. It's been, you know, nice to see. I mean, part of what you talked about is labeling and just naming your feelings. So a number of people have talked about sort of this overwhelming feeling of hopelessness. And I'm trying to sort of describe or once again condense a few. A few people have mentioned excessive sleeping or napping right now, sort of this overwhelming or hopeless feeling. And so how do we handle or deal with feeling like there's no end in sight, you know, right now?
Right. That is such a difficulty, and we're also hearing, you know, in the news or so forth that, you know, we don't know exactly what's going to be happening at this point, and so there is incredible uncertainty. So in this, trying to think about, you know, what do I have control over right now, and bringing the focus back to the present, and in part bringing the focus to the breath. So, you know, practicing those deep breathing techniques. I know I keep bringing those up. That is a way of really be learning how to focus in the moment, rather than focusing on what may be happening in the future. It can also be useful to think about actually labeling the thoughts, not only the emotions that you're having, but are these helpful thoughts? So it could be something of, one strategy I've learned is closing my eyes and picture that I'm standing, on a bridge over a river, and I can imagine bowls that are flowing down the river, two bowls, and as they flow down the river actually splits. On the left side are unhelpful thoughts. On the right side are helpful thoughts. What I can do is just as the thoughts arise, imagine putting those in a bowl that then floats down the river and it floats to the unhelpful side. Or maybe I'll have a thought and I can label it as, uh, I'm going to have a great lunch today. That's a helpful thought. And so putting that down the right part of the river. So those types of tools, though, and once again, that self-compassion of, yeah, I'm feeling down now. And if my best friend or someone I loved had this thought, what would I tell them? It might be I would tell them, it's tough right now. You've been through difficult things. You're going to get through this as well.
Thanks, Alex. I know around my family and in my own personal practice, focusing on what's happening right now has been really helpful. And also, I had heard about the 3 good things before, but when you brought it up and I saw your presentation, I've been also working on sort of 3 good things I can anticipate happening. This idea of sort of planning out, like you said, pleasurable activity throughout the day. Sometimes in mornings when it feels really rough, I'll wake up and think about what 3 good things are going to happen today. Whether or not they do is irrelevant at that point. It just helps me sort of wake up and get going on my day. A couple of interesting things that have come on is if you have any tips for people that are struggling specifically with insomnia. I know sleep is such an important component of our health and our recovery, our recuperation. For those of us that are experiencing insomnia right now, do you have any specific tips?
Absolutely. The first thing is really, before one is going to bed, really trying to have a good wind down routine. So that can be, whatever you can do to settle yourself. In part, that can be taking deep breaths, the ones that I've mentioned, or doing a relaxation exercise, making sure to reduce screen time a little while before you go to bed, and do not read the news or anything like that in bed. That will stimulate and wake up your brain. Could be something like taking a bath or a warm shower. Even a light snack before you go to bed can sometimes help begin to calm and relax your body. And then, if people are finding that they're waking up in the middle of the night, then using that particular tool, the stimulus control, that's the fancy term for it, but getting out of bed and then doing something relaxing and returning to bed when you're sleepy. Those are the behavioral tools. Making sure to limit caffeine intake, limiting any tobacco use as well. Both of those are stimulants and can wake you up as well. So being very careful, and if you're having coffee at the end of the day, be mindful of that. And if you're continuing to just struggle with insomnia, that would be something where I'd encourage you to reach out to your healthcare provider as well.
Thank you, Alex. I know that alcohol can have an impact on people too, and we know that a number of people are maybe turning to more drinking at these times also.
Yeah, thank you for bringing that up. That is a great point. As people are, drinking, and that can be something very easy to turn to in these times, and that can have an effect on mood. Also, marijuana use as well, that can increase anxiety for folks. So it's generally not a good tool for depression or anxiety. No, the evidence doesn't point to it at this point.
Great. Thanks for mentioning that. We have a number of clinicians, doctors and other folks on the town hall meeting today, like yourself, that are struggling without the social interaction that they normally have with clients and patients. So transitioning so many appointments to telehealth, to using Zoom, to only having call and video conferencing. Any suggestions either from your own practice or to the other clinicians on our presentation today about how to maintain some sort of connection socially with their clients and their customers, even when we're doing this physical distancing and all these telehealth appointments. But clearly it's impacting the mood of your colleagues as well.
Absolutely. I've been conducting video visits with the clients and patients I serve, and while I'm grateful to see them, there is something that's missing from that. The touch, just that felt presence. So one of the things I've been doing, at least, is one of the things or something that's been interesting that I have not experienced with visits that I have in person with patients are that I get to see a little bit of their home and they get to see a little bit of mine. And so that's something that I will ask them about. I'll be like, oh, what room are you in your house? Or I'll point out, I do have a secret love of cats, and so I've got my cat pillow back there. I also, make sure to let the folks that I'm working with know that I'm genuinely glad to see them, and I really am. I feel it's a privilege to get to serve them even virtually, and so keeping that in mind, that even though it's a different connection, I'm almost doing a home visit with them, and that reframe has been helpful for me, and maybe a way of reframing it for our providers that are on this as well.
Thanks again, Alex. Really appreciate your responding to everybody's questions. I know we couldn't get to all of the questions that came up today. I want to give a few minutes for us to talk about what we have coming up next. So again, I'm going to share my screen now, and thank you, Alex, for joining us.
My pleasure. Thank you so much. And thanks everyone for joining in. I really appreciate it.
So we are committed to continuing to provide resources to all of you that are participating both on our town hall meetings and our regularly scheduled webinars. Next week, we have a webinar that was scheduled actually back from a few months ago. So we're taking a pause on the town hall series, and we have the silent epidemic of eating disorders in the workplace, a really important topic where we'll be speaking with Amanda Kuyawa from our own Center for Health, Work, and Environment, as well as Sabrina Skanga from the Eating Disorder Foundation. And they're going to discuss this important topic of the silent epidemic of eating disorders in the workplace. I want to mention that we are going to resume our Monday Town Hall series on Monday, April 27th, with an interactive dialogue with several employers in our network about how COVID-19 is impacting the workplace. We plan to hear from an organization in hospitality, in finance, in construction, and in local government. That's our goal. So while next week we're going to have this regularly scheduled webinar on April 22nd, the following we'll relaunch the Town Hall series on Mondays at 11 a.m. Mountain Time with a conversation with how employers are how they're adopting and adapting rather to new workplace practices. And just a few thoughts as we wrap up today's webinar. Once again, we want to thank our presenter, Dr. Alex Reid, for joining us today. A few of the takeaways that I had from Dr. Reid's presentation are breathing deeply throughout the day, the exercise that we all did together, as well as planning out a positive activity. And if you can rate your mood before and after that, you may see that things have really improved. And a lot of you on the polling question said that you're going to take up the 3 Good Things activity. Here, I want to mention that we are going to share a recording of the webinar today, as well as Dr. Reid's presentation. The slide deck will be available, including the one on how to put the 3 Good Things exercise into practice and journal about it. So there are a number of things that we'll share. Give us a little bit of time to get those posted up on YouTube and also to get a link to the slide presentation, but know that you'll be hearing from us in the next few days with those resources. We really appreciate all of you participating with us today. I'm going to leave this up. There's a few ways to stay connected with Healthlinks. Our website is there. You can join our newsletter to get up-to-date information. You can email us directly, We're offering free advising sessions to employers right now, whether you're in our network or not. We're getting a lot of stories collected about how employers are responding to the pandemic. Some really great stories about how they're engaging workers remotely when they've never, this is new for them and they've never done that before. So you can email us at contact@healthlinkscertified.org. You can schedule a free advising session. And then our social media channels are listed there on your screen as well. On Facebook, we're at Healthlinks Certified, as well as in LinkedIn, our company profile is Healthlinks Certified. On Twitter, you can find us at Healthlinks News. So stay tuned for more information from us. Once again, next week is a webinar on eating disorders in the workplace, the silent epidemic. We'll reconvene the town hall series in 2 weeks with a panel, and we're committed to continuing to provide resources and education information to all of you as we all last out this coronavirus together. I just want to mention again, we're grateful for our team at Healthlinks and the Center for Health, Work, and Environment. The health, safety, and well-being of our workforce is of paramount importance to us. It always has been, and we're glad that you can join us and participate with us today. We feel like we're all in this together.